This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program. I'm Dave Wilson. Our guest this morning is Dr. William McBee, gynecologic oncologist, and we're going to be talking about women's cancer care. September is Gynecologic Cancer Awareness Month. We'll dive into the topic in just a moment. Please welcome Dr. McBee to the program. Dr. McBee, good morning. Thanks for joining us.
Good morning. How are you?
I'm doing quite well. We'll dive into our subject in just a moment, but first, we begin every show by getting to know our guests just a little bit better. So give us a little rundown about your background, where you're from, where you went to school, and how you ended up working with Mon Health.
Okay, yeah. So I grew up in Morgantown, went to Morgantown High, and then did undergrad in medical school at WVU. Actually, I was born at Mon General several years ago, and then I did residency in Cleveland. It was a combined program between Cleveland Clinic and Metro Health. And then did that was an OBGYN, and then did fellowship in gynecologic oncology at Pittsburgh, McGee, UPMC, and then came back in 2010, and I have been practicing here ever since.
So how did you choose the specialty?
The specialty is pretty unique because it's, one, you follow patients for a very long time. So I didn't want to do something where you just see a patient, treat something, and then didn't see him again. So I kind of like the long-term aspect of the patient care. And the other thing that I liked a lot about it is it's really the only cancer specialty where you do surgery and chemotherapy. You know, for medical oncologists, they do, chemotherapy only, and surgical oncologists, for the most part, do surgery only. So it's really unique in that you get to do both aspects, so kind of comprehensive cancer care, minus radiation, but comprehensive cancer care for patients with GYN malignancies. And again, you get to follow patients for a long time.
So I mentioned September is Gynecologic Cancer Awareness Month. Can you share what kind of cancers we're talking about and who would be at risk for them? So
the most common type of gynecologic cancer is uterine cancer, or more specifically cancer of the lining of the uterus, endometrial cancer. The biggest risk factor for that is obesity, but certainly plenty of patients that are not obese, develop endometrial cancer. So I think the important part of that is just to make sure that you follow up with a gynecologist regularly at whatever age you are, and that if you notice any changes, postmenopausal bleeding, abnormal bleeding, that you see somebody. And then the other cancers that we treat oftentimes are ovarian cancer and cervical cancer. Ovarian cancer oftentimes doesn't have a lot of early symptoms like endometrial cancer does, but it's still important to kind of be in tune with your body. If you notice something different, to talk to your gynecologist about it. As far as the cervical cancer, again, routine screening is important to detect cervical cancer early, and importance of HPV vaccine. And then the other things we treat are vulvar cancer some, and then vaginal cancer pretty rarely. But also, I think the importance is to find the gynecologist that you're comfortable with and see them on a routine basis.
You mentioned some of the screenings tests that are available to detect these cancers early on. So what are the screenings, or what are some of the screenings that are available and can be part of your wellness checks?
I mean, the biggest screening really is for cervical cancer. I mean, and that's a Pap test, and also to check for HPV. The other screening tests are really a lot of times just observation and following. So there's really not screening tests, for example, for ovarian cancer. There's really not a screening test for most patients with endometrial cancer. And certain patients with high risk to develop endometrial cancer, we will do endometrial biopsies, for example, to screen them. But really, and as far as GYN goes, cervical cancer is the only cancer with a screening test, but a lot of the other cancers can be detected early with diligent follow-up with gynecologists and noticing things that may be changing.
So we mention this a lot on this program. If something is off or seems off, Don't just brush it off and go, well, it's probably nothing. Go ahead, bring it up to your doctor, and that can often maybe catch something in the very early stages.
Yeah, absolutely.
Dr. William McBee is our guest this morning, gynecologic oncologist. September is Gynecologic Cancer Awareness Month. We'll continue our conversation after a quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. William McBee, gynecologic oncologist. September is Gynecologic Cancer Awareness Month. And we've mentioned some of the screening, some of the things to look out for. What about treatment programs, Dr. McBee? What is available?
So, if you look at cancer care in general, cancers can be treated with surgery, chemotherapy, or radiation. And a lot of times with GYN malignancies, fortunately we can treat this with surgery only. Pretty much all of the surgery we do at Mon Health is minimally invasive, whether it be laparoscopic or robotic. We really don't do open incisions for hysterectomies and other than very rare situations. So everything is minimally invasive. Almost everything is outpatient. Patients almost always go home the same day as the surgery. And then in patients that do need additional treatments, whether it be for advanced cancer and sometimes we give additional treatments such as radiation or chemotherapy to reduce the risk of recurrence. We do all of those things here. So whether the patients need surgery only or surgery and chemo or surgery and radiation or all three, we offer all of those treatments right here.
How common are these types of cancer? Do you see them? You're an oncologist. You see them on a regular basis. But as far as out in the population, are they fairly common?
Yeah, they're fairly common. If you look at the incidence of endometrial cancer, for example, it's probably close to 60,000 cases a year. So it's not as common as breast cancer, but it's the most common gynecologic cancer. So it's actually fairly common. Ovarian cancer and cervical cancer are less common, but still, not something I would call rare. It's a little bit skewed because the patient, I see a lot of all of it because there's not a whole lot of gynecologic oncologists in the state. So I do see patients from all over the state and some of the surrounding states as well. So we do see a lot, but that being said, it wouldn't be uncommon for someone to know somebody with any of these cancers. Earlier,
you mentioned the HPV vaccine. Can you explain just a little bit more about what it is and what it can protect against?
So, we're finding that initially it was developed to reduce the risk of cervical cancer, but since that time we found that HPV is the most common the most common citing factor for head and neck cancers, anal cancers, vaginal cancers, cancers of the penis, cervix, and vulva. So it's really reduces risk of all of those. So the recommendation is that boys and girls get vaccinated as early as age 9. But I think a good time is 10 or 11 or 12, and most of the pediatricians in the area do a really good job of making sure that the kids in that age group are vaccinated, because that's really the age to vaccinate. We certainly do vaccinations of patients. It's FDA approved up through either age 45 or 46, but we still catch patients after exposures too and vaccinate them because the vaccine that's out now covers against 9 different types of HPV virus. So certainly it's better to get vaccinated before any exposure, but even after exposure, the vaccine is still worthwhile.
Talking to Dr. William McBee this morning, gynecologic oncologist. Can you talk about Mon Health's recent accreditations to that attest to the gynecological care that's available there?
Yeah, we accredited in chemotherapy, so all of our nurses are accredited. We have numerous accreditation as far as minimally invasive surgery, not only for GYN cancers, but across the spectrum, other GYN surgeries, urology, both laparoscopically and robotic.
When someone needs to be seen by you or your team there at Mon Health, is that going to be a referral from your primary care physician? I guess that's my first question, is how do they get to see you? And then can you just walk us through what that first appointment would be like?
Yeah, so a couple things. One is we're extremely efficient getting patients in. If somebody would call the office today, I might see them today. If not today, they would be later this week. So we're very, very good about getting patients in a timely manner into the office, and then if they need surgery or whatever treatments they do, we kind of pride ourselves with getting them into the next step. So if someone would see me, call the office today for an appointment, I would see them this week, and probably if they needed surgery, could operate on within a week or two. So we're very, very efficient, and again, we take pride in that. As far as the referrals go, most of my referrals come from OBGYNs, but certainly I get a lot of referrals from primary care providers, patients through the emergency room, patients that get admitted to the hospital, and then I get consulted. And there are a handful of patients that just are self-referred. They either seen somebody else, they want a second opinion, or they just call because they have an issue. And I'm certainly happy to see those patients as well. And as far as the referrals, our office number is 304-285-3870. They call and make an appointment, and like I said, we get them right in.
And that first appointment would be, what would that first appointment involve?
Yeah, so the first appointment is, see why they're there, and then if they already have a diagnosis of cancer, or if they just have something that needs worked up, if they have abnormal bleeding, for example, or they need haven't had a pap test, or they need an endometrial biopsy, or they need an ultrasound, or it depends. I mean, it really it covers a gamut of all different things that patients may come in with. Sometimes patients may come in, unfortunately, they've seen the emergency room, they have a CAT scan that's concerning for cancer, or they just have an abnormal. A lot of times patients will come in with they've already seen their gynecologist, they have an abnormal pap test or cervical cancer, or already been diagnosed with endometrial cancer. So it really depends. It's very different. I mean, every new patient is unique.
Talking to Dr. William McBee this morning, gynecological oncologist. After that initial appointment, or maybe it's during that initial appointment, how do you go about developing a treatment plan for the patient? Because one thing I've learned after doing these shows for several years now, Dr. McBee, there's no one size fits all. Every patient is unique. Every circumstance is different. So how do you go about developing that treatment plan for the patient?
Like you just nailed it. I mean, so a lot of times patients will come in. Let's say, for example, if they have a biopsy shows endometrial cancer, but they have a kind of a low risk type of endometrial cancer. They may not need any other workup. They may just need surgery. So that may be the next step. And then, but it's not even that simple. Sometimes they may need surgery. They don't need any sort of clearances, or they don't need any pre-workup. Sometimes patients come in that are sick, and they need we need to do X, Y, and Z before we can take them to surgery. Sometimes they don't come in with a diagnosis, and then you have to order several tests to kind of figure out what's going on, or maybe what's going on, but you still need a few more tests to kind of clarify things before surgery. So it's different. Sometimes patients come in kind of ready to go, and you just the surgery's the next step. Sometimes you got to do several things before you can do that.
Our guest this morning, Dr. William McBee, gynecologic oncologist. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. William McBee, gynecologic oncologist, is our guest this morning. September is Gynecologic Cancer Awareness Month. And before the break, we were talking about the treatment programs, developing those. But can you expand a little bit more about the type of care that women receive at the Mon Health Cancer Center for gynecologic cancers?
Yeah, so it's really comprehensive care. I mean, so whether it be seeing patients in the office, which is the first step, and then if the patients need surgery, I mean, the surgery team we have is amazing. I mean, from the pre-op nurses, the post-op nurses, whether they go home the same day. I mean, every patient that I see, after surgery always comments about, what great care they received, and they've never, been to a hospital that they felt they were treated so well. And if the patients need to be admitted to the hospital, I mean, the same holds true for the nurses and the staff that'll see them while they're in the hospital. And then if they, need chemotherapy, we do chemotherapy here. The chemotherapy nurses are amazing. So there, again, it's a small kind of intimate group that will take care of the patients and kind of see them through all of their treatments. We have a great, nurse navigator that makes sure the patients don't need anything, whether they would need, transportation things, gas cards, places to stay, all of the different things that may happen. And then the third thing would be radiation, and the same holds true for the radiation. We offer, comprehensive, radiation oncology care for really any cancer type. And and it's all right here in our cancer center.
Why is it important to provide all of that service, to have that comprehensive treatment available for patients?
I mean, I think for two reasons. I mean, one, logistically, it's a lot. It's hard to get this part of your treatment here and then make an appointment and get a referral for something outside a different hospital, or it's nice to have it all in one place. And the second thing is for patient care. I mean, so it's a lot easier to if you have radiation oncology, for example, here. It's because we didn't at one point, and I remember very well what it was like. I mean, trying to coordinate, and it's nice just to be able to have a conversation with a radiation oncologist. Again, not that you can't do that at a different hospital, but it's certainly, I think it's better for patient care that you can communicate with, whether, or if I'm, referring to the medical oncologist for chemotherapy for a cancer type that I don't treat, for example, then, it's just nice to have, for patient care to have everything under one roof.
I know every patient, again, is unique. Every circumstance is individual. But what are some of the common questions when you're talking to patients? Do you get concerning whether it's the treatment plan, the services available? What are some of the common questions you hear from patients as you have some of these conversations with them?
I mean, I think the first thing, with anybody that's diagnosed with a cancer, I mean, the first thing they're going to ask, what's their chances of being cured? What does this look like? How is the treatment's going to change their life? So I think that those are the questions they ask. And then in patients that can't be cured, then it changes a little bit, and they still want to know, how long they're going to live, what you can do to treat them. But then maybe you also look more at, what you can do to limit side effects if you don't have as high for a chance of cure, right? So you're looking at how you're going to maintain, a quality of life. Not that you don't do that in patients that you can cure, but certainly you're willing to sacrifice a little bit of quality of life to cure whatever cancer they have. But in patients that do recur that aren't curable, you balance quality of life more so than I think you do initially. But I think it's important, at every step. But certainly those are the questions people have. How it's going to affect me. How long do I have to live? Can this be cured? And what do the treatments look like?
Are patients, even today in 2024, still surprised that so many of the procedures are minimally invasive and can be done on an outpatient basis, and they could end up going home the very same day?
Oh, every day. Every day I hear it, or like I'll operate on somebody, and then someone will show me their big up and down scar on their belly and say, I wish I had my hysterectomy done like that. I mean, so yeah, people are shocked that you can do it the same. I mean, at least every day, multiple times a day, people are really shocked that you can do it that way. Are these cancers preventable, or is there anything you can do? You mentioned the vaccine, obviously, but are there things you can do in your everyday life to help lower the risk of these types of cancers? Yeah, I mean, I think that the most common, the takeaway from that would be, living a healthy lifestyle. So I think that, maintain, good weight, eat right, and then try to exercise. I mean, those will eliminate, to be honest with you, the most common GYN cancer, which is endometrial cancer. Not all the way, but it would certainly do a lot to reduce that risk. Cervical cancer is, like I said, HPV vaccine, and then screenings. And then the third thing is that, there's certain things at the end of the day you can't prevent, but that being said, finding a provider that you're comfortable with, especially when it comes to GYN stuff, finding somebody you're comfortable with, you can talk to, and that make sure you see them regularly.
What's if listeners only take one thing away from our conversation today, Dr. McBee, what do you want them to take away?
Find a provider that they're happy with. You know what I mean? Because the provider should do all the other things. So even if you don't know anything else about, whatever, eating right or exercising or maintaining a healthy weight or the HPV vaccine, if you don't know about any of that, if you find somebody that you're comfortable with and you go to them on a regular basis, they should walk you through those things.
Dr. William McBee, gynecologic oncologist. September is Gynecologic Cancer Awareness Month. Where can folks go for more information?
Yeah, so the website is, hold on, I'm going to have to pull it out here so I tell you guys correctly, is monhealth.com /cancer.
monhealth.com /cancer. Dr. McBee, thank you so much for the time this morning. I appreciate the conversation. Always good to speak with you.
You too. Thank you. Have a good day.
You as well.